Listening Test. Sample Test 2.
This test is published and recorded by 9.09er English. This recording is copyright. This test consists of 3 parts. In each part, you will hear a variety of recorded extracts. Before each recording, you will hear this sound. You will be given time to read the questions before each recording is played. Listen carefully as each recording will only be played once. Answer the items as you listen to each extract. You will have 2 minutes to check your answers at the end of the test.
Part A. You will hear 2 different recordings. Each situation is a conversation between a medical professional and a patient or relative of a patient. You will have to answer questions 1 to 24 by completing the test as you listen to the recording. Extract 1. Questions 1 to 12. You will hear a university student called Leon Horvath, who is part of the tennis team of his university and is experiencing sharp shoulder pain. Answer the items with a word of a short phrase to complete questions from 1 to 12. You have 30 seconds to review the patient's information sheet. Good morning, Mr. Horvath. I'm pleased to meet you. How are you?
I'm good. How about you?
I'm great, thank you. The university clinic sent over your medical records, but it would be better if you could tell me what happened, in your own words. Walk me through the timeline from the time it happened until now.
Well, I'm a tennis player and will compete in the summer inter-school competition. I started my training 2 months ago, and it was challenging and strenuous because I had to work out in the morning and practice drills after school. We had long practice sessions, especially on the weekends. About 3 weeks ago, I felt a sharp pain in my right shoulder. At first, I thought it was just muscle pain, so I placed an ice pack over it and had a few painkillers. The pain eventually disappeared, so I just continued with my daily training.
Okay, how long did the pain last?
An hour maybe. But the following day, I felt sharp pain again in the same spot, even before I could start my morning exercise. I tried to stretch and gently massage the area this time, and then the pain subsided. This situation went on for another 3 days. Some days, I would take pain medication to continue with my workout. After that, I noticed that the pain would intensify if I slept on my right side. It felt almost like a burning pain at the top and front of the shoulder and the outer arm. The pain was enough to wake me up, but it slowly waned when I changed position. It was so uncomfortable, and I couldn't sleep at all.
Are there other movements that trigger the pain?
Well, the pain was more evident while doing drills or practicing my swing. There are some movements, like when I do a one-handed backhand in a volley stroke, that the pain can be so unbearable that I'll lose my grip.
Did you have previous injuries?
Oh, yes. I dislocated my right shoulder, that same arm, a few years ago. 2 years ago, I think. I got into an accident snowboarding while on vacation with my family. I also broke these 2 fingers. It's not something new to me, though. I am very adventurous and enjoy outdoor activities so much that I always get into these kinds of accidents. Anyway, we visited the emergency department and got a few tests, including an x-ray. Luckily, nothing was too serious. The doctor said that I had to wear the thing to prevent my arm from moving. I think it's called an arm sling. Then I had medications for the pain and swelling. It wasn't as painful as this one, though. I think I was able to play tennis 2 weeks after that incident.
Did you go to therapy after that?
No, I didn't think I had to go to therapy for that. Is that the reason for my shoulder pain?
Well, injuries can also lead to the inflammation of the tendons, which can be the reason for this case. That should be okay if you did not have any movement problems and did not experience pain. Let's go back to your shoulder pain. When did you see the university doctor?
It was the 5th day that I was experiencing the pain. At this point, the episodes of sharp pain became more frequent, and it was more painful. I came to see Dr. Kent and told him about my shoulder pain, and he checked my arm's range of motion through flexion, abduction, and rotation. I'm familiar with this because we always do this before training. I told him the pain occurs when I lift my arms to the side. It also felt a little stiff, and I felt a slight resistance when I tried to do the rotations. He said this was most likely tendinitis and would refer me to a physiotherapist for treatment. Is it something serious?
This condition is manageable, but can progress to more severe if we don't address it quickly. I agree with Dr. Kent regarding his assessment. However, I have to do a couple of tests to confirm. Do you mind if I examine you?
Not at all. Go ahead.
Do you have other concerns you want to discuss?
Well, I want things to return to how it was. I am a very active person. Outdoor activities make me happy, and my tennis career is important. But now I'm so anxious because I have not practiced for a while, and the tournament is just a few months away. I have been preparing for this for so long that I don't know if I'm losing sleep because of my shoulder or because I'm getting a bit depressed.
I'm sorry to hear that. I understand that the situation has not been easy for you, but you will be back on your toes faster if you work together. Now, I will be conducting confirmatory tests to know if it's affecting your supraspinatus, the muscle located on the back of your shoulder. Then, a series of deep transverse friction massages paired with continuous physical therapy will help reduce the pain and inflammation. You will have to do strengthening and stretching exercises. Extract 2. Questions 13 to 24. You will hear a dermatologist talking to a patient called Celeste Gonzalez. Answer the items with a word of a short phrase to complete questions 13 to 24. You now have 30 seconds to review the patient's information sheet.
Hello, Mrs. Gonzalez. Your GP has referred your case to me. I see here that you primarily came for an anxiety consultation. Can you tell me more about what happened?
Hi, good morning. Yes, that's right. It started a year ago. At the height of the pandemic lockdowns, everything was just so chaotic. I lost my job as an image consultant for a beauty brand. Though we do not have any children to support and live a comfortable life, I thought of not having a job really got me. I started having panic attacks, especially in the middle of the night. I would wake up feeling like I was drowning in sweat profusely, and sometimes I'd have to catch my breath. When the numbers of COVID positive shot up, I was wrecked. I would cry over small things, and I would become very paranoid. I would have myself tested for COVID regularly just to ease my anxiety, and every time it comes out negative, I felt a little relieved, but never completely okay.
Oh, that must have been so tiring. Did you take any medications?
Yes, I had an appointment with our doctor, who prescribed anti-anxiety medications to calm myself on unbearable occasions. But I also took melatonin to help me sleep at night. But it felt like it was not enough because I would still wake up. And honestly, it gave me headaches. I also joined online yoga sessions. That really helped me a lot, actually. It helped me focus more on my breathing. I felt relaxed. I started to listen to music often too. I didn't want a very quiet environment, especially during the day because I'm usually alone. My husband is a chef at a hotel downtown. Especially what really bugged me the entire time was sweating more than I typically do. It's not just a regular it's hot outside feeling. It's another level that I have to change my clothes a few times a day, and I would take showers regularly. At first I thought it was the anxiety, but it looked like a completely different thing.
Can you tell me which body parts you feel sweat a lot?
Yes, This isn't very comfortable. It's usually the armpits and the groin area over here. I'm really embarrassed about this. You see, in my job, I'm used to dressing up nicely and looking presentable all the time. This is something that was certainly not a problem before, but now I started to feel really conscious about it. I began using antiperspirants and other creams, hoping they would somehow help, but nothing. It was still as bad. My husband told me to have it checked, and I did.
That was a great decision. Then what happened?
The doctor said that there were various medical conditions to consider, but he finally narrowed it to hyperthyroidism and hypoglycemia. It made sense because both of those were not new to me. My aunt has hyperthyroidism, and my mom has had problems with the sugar. So I had a couple of blood tests, and I also had a urine test. You'd think that I would be relieved to know that the tests came back negative, but I felt more frustrated. I meant that it was not the problem, so we did a few set of tests. I had a sweat test. Something to do with iodine. I forgot the name.
Iodine starch test?
Yes, that's it. Then I also had a thermal regulatory sweat test. After a while, the doctor concluded that it was a sweating problem called... Oh, wait, I wrote this one down because I could never remember it. Let me see. Here, I have hyperhidrosis. I had no idea what this was before, but he said it was because of another condition. He said that hot flushes must trigger it because of menopause. Now, I did not see that coming. I know I'm 55 years old, but I have never thought of menopause.
I can imagine. It's a rather sensitive topic for most women. The great news is that we can try a few treatment plans.
That is excellent news indeed. I'm pretty excited to move forward.
That's great. So we could try a botulinum injection, or what is commonly known as Botox. Nerve-blocking medications will also help maintain the effect of the Botox, so you won't have to do it very often. I would need to make a couple of tests, then we can start.
This is the end of Part A. You may now proceed to Part B. Part B. You will now hear 6 different recordings of people talking in various healthcare settings. For questions 25 to 30, you will have to answer questions about what you hear. In this part, choose A, B, or C. Choose the item that best suits the scenario in the recording. You will be given time to read each question before the recording is played. Now look at question 25. You will hear an emergency department nurse endorsing a gunshot wound case to a colleague.
We have a patient, male, 33 years old, who was presented to the ED with a single, closed gunshot wound to his left foot. He is awake and responsive and is currently on pain medication with broad-spectrum antibiotics while waiting for his test results. I endorse this case to the on-call resident surgeon for further assessment, so kindly make sure everything is well documented. Please rush the laboratory tests, especially the drug and alcohol test results. You can call the laboratory to make sure this happens.
Okay, the police just arrived and want to take a statement from the patient. Should I let him inside?
Yes, that's okay. The patient knows that the police will interview him, given what happened to him. Please have them sign the visitation logs before they come in. They would probably need the results of some of the tests, so kindly make copies for them. Do not forget to note that in his chart.
I will. Are there any family members that should be informed?
Yes. Kindly call his wife. It's in his emergency contact file. He mentioned they have a 3-year-old daughter, so please have the social services on standby if they need it.
Okay, I will take this case over from here. Thanks. Question 26. You will hear a part of a lecture about nasogastric tube insertion.
After inserting the nasogastric tube, verifying the tube's placement is crucial. There are many ways to do this, but these are the most common practices in a traditional hospital setting. One way to check the tube placement is to order a chest X-ray. This is a reliable choice, though it might take some time, so it is not for time-sensitive cases. Aspirating gastric contents using an irrigation syringe is another way to check the proper placement of the tube. A pH of less than or precisely 5 will confirm the correct gastric placement. Lastly, and the most commonly used by most medical practitioners, is auscultation. Using a stethoscope, you can listen to the patient's epigastrium for a whooshing sound while incorporating a 30 cc air bolus using an irrigation syringe. Depending on the hospital's protocol as to which procedure to use, ensure that proper placement verification is done every time before giving NGT feedings to avoid complications like aspiration. If you can't verify the correct placement of the NG tube, remove it immediately. Check the patient's vitals and reinsert it.
Question 27. You will hear a dentist talking to a patient about oral hygiene. Now that I'm working in sales, I've been conscious about my teeth because I talk to many clients. I want to make sure that I keep them healthy. So, besides brushing my teeth regularly, are there other ways to keep my teeth healthy?
That's a great question. Regular teeth brushing is essential to keep everything clean and avoid any plaque buildups. Fluoride toothpaste is also necessary to protect the teeth from decay and cavities. You can use dental floss or wooden or plastic pick, but a dentist should recommend it.
I heard that flossing could destroy the gums. Is that true?
That is a common misconception. The gums get destroyed if the gaps between the teeth are not cleaned regularly. Plaque buildup will harden below the gum line and can easily irritate the gums. Eventually, it could lead to swollen gums that bleed easily. These are signs of gingivitis. An easy fix is to floss regularly to ensure no food debris is left.
Oh, wow. I'm glad you said that because I haven't been flossing for a while since I heard about that.
It's essential to verify medical facts with healthcare professionals.
Right. Well, thank you so much for all the information. I'll see you in the next month for my cleaning appointment. Question 28. You will hear a part of the discussion about legal consent in emergency in the hospital.
Minor patients admitted to the hospital will automatically require consent from a legal guardian before any medical evaluations and treatment. However, when a parent or a legal guardian is unavailable in any emergency medical condition, the hospital's policy should be followed. In our hospital, it is stated that any medical care needed that will most likely prevent imminent and significant harm to a child or an adolescent patient should never be delayed or withheld because of problems obtaining consent. This policy's primary concern is providing clarity and guidance to all medical personnel to know how to scrutinize situations where parental consent is unnecessary. This also applies to circumstances where a parental refusal of consent places a child at risk of significant harm.
Question 29. You will hear a vascular specialist talking to a group of medical interns about a post-pulmonary embolism patient.
The next 36 hours are very crucial. Please inform nurses to keep an eye on signs of bleeding. Intracranial bleeding is the most severe possible complication, so please watch the patient's GCS. Thrombolytic therapy is the best option due to his unstable condition. However, very close observation should be done.
Yes, considering he had just his prostatectomy 2 weeks ago, his risk for bleeding is higher. He also just had angioplasty yesterday. I will also check for bruising and signs of internal bleeding.
Right. He does not have kidney disease or diabetes, but I'd like to monitor his ABG and report any inconsistencies. He can walk around to promote circulation, but please inform the patient of his room's assistive devices. Remind him that he can't have any injuries while we are in the critical window. Does he have a spare set of compression stockings?
I already requested a new pair of compression stockings. I will make sure that he wears them all the time.
Okay, great. Let me know if there are any changes that I should know about. Thank you.
Question 30. You will hear a dietitian briefing the kitchen team. Food allergy is a serious condition, so you must be extra careful in preparing the patient's meals, especially those with food restrictions. All food allergens such as chicken, eggs, milk, and nuts should be handled meticulously. There are separate utensils for these too. Upon dispatch, make sure to label the container and include the patient's allergy information. The new hospital policy requires us to have a list of the key ingredients and the food for the patients. I have requested a collaboration with the head cooks so we can come up with a list weeks before so it can be prepared and printed earlier to avoid mismatches and mistakes. Lastly, if you receive any requests from the patient, please run them by the kitchen supervisor so she can address them to me appropriately. All approved requests will be sent to her as well. This is the end of Part B. You may now proceed to Part C. Part C. You will now hear 2 different recordings of health professionals discussing a topic in their field of expertise. For questions 31 to 42, you will have to answer questions about what you hear. In this part, choose A, B, or C. Choose the item that best suits the scenario in the recording. You will be given time to read each question before the recording is played. Now look at Extract 1. Extract 1. Questions 31 to 36. You will hear a specialist called Dr. Nelson Chang talk about attention deficit disorder and how a healthy diet can positively affect this condition. You now have 90 seconds to read the questions 31 to 36.
Hello, my name is Dr. Nelson Chang. I'm an early childhood and development specialist, and I'm going to talk about attention deficit hyperactivity disorder, commonly called ADHD, and its positive effect on a healthy diet. I want to start by saying that the term attention deficit is very misleading. Generally, the predominating theories about this condition say that individuals with attention deficit hyperactivity disorder, or ADHD, and attention deficit disorder, or ADD, have difficulties controlling their attention. It also implies that they inhibit concentration on non-relevant stimuli and, at the same time, tend to focus too much on specific motivation, no matter how insignificant. I want to give light to this definition. I believe that those who have ADHD and ADD pay too much attention to too many things, which ultimately results in a lack or little focus. In the early 1900s, the diagnosis of hyperactivity made its mark. However, today, impulsivity and inattention are added to the mix, so it is safe to say that this condition is not new, contrary to what many social media accounts publish nowadays. The treatment for ADHD in both children and adolescents starts with stimulant medications throughout the years, like methylphenidate agents and amphetamine or mixed amphetamine salts agents. Other interventions such as educational, behavioral, or psychotherapeutic interventions have not been effective in controlling the fundamental features of ADHD in most children. However, many alternative management approaches can significantly ameliorate certain aspects like oppositional behaviors, parent-child problems, and social peer problems that often accompany ADHD. For today, I want to focus on a different approach that I think is highly beneficial to all and not only to children with this condition. For many years, the diet has been suspected of contributing to the cause of ADHD. Many parents have tried to avoid certain nutrients and food groups while adding other supplements to help improve the symptoms. Although many researchers and experts say that kids with ADHD are more likely to have unhealthy diets, this does not predict their present symptoms. In the same way, while it is true that a change in the diet is not expected to be central to its development nor its treatment, the underlying symptoms may be responsible for the dietary differences. So, you see, we are looking at it the wrong way. Since we all know that most of these kids appear to have unhealthy diets, we must watch their dietary needs and ensure that they get a well-rounded diet. Let's talk about the research that we've been doing by sharing the journey of a 7-year-old girl named Amira, who was recently diagnosed with ADHD. When we met her for the first time, she constantly fidgeted and tapped her hand on her knees or the wall. She was very uncomfortable when I would ask her to sit down. When I talked to her, she seemed very excited to blurt out answers even before I finished asking the questions, and she had a tendency to speak excessively, even when she was not a part of the conversation. When I asked Amira's mother about her diet, she revealed that it was primarily high in sugar and junk foods. She said that it has become challenging to feed her, so she gives the most accessible and tastiest snack to calm her down, which unfortunately consists of cookies, donuts, and her favorite, potato chips. And because she is also exhausted with her full-time job and taking care of Amira, this happens often. This story is prevalent among households with children who have ADHD, and this is actually the foundation of our research. Amira became a part of a triple-blinded study together with 134 children with their parents at 3 sites. Random participants would either get a micronutrient or placebo capsules for 2 months, and parents and clinicians would report any changes. This means that parents, children, and any clinicians were unaware of the treatment allocation given to each participant during the study. Amira, who fortunately took micronutrient supplements regularly during the research, showed overwhelming positive effects on her behavioral, emotional, and physical well-being. She had more control over her emotions as she could follow instructions more while being able to converse more patiently. Her 6-millimeter height growth was the study's highlight, as 54% of the group had the same improvement. This is excellent news, because the primary concern with ADHD medication is height suppression. Using the 36-ingredient vitamin and essential mineral supplement successfully improved the symptoms of ADHD and poor emotional control in participants aged 6 to 12 years old. The study shows that ADHD is related to low levels of neurotransmitters in the brain and that micronutrients have a vital role as cofactors in ensuring that the body can produce important neurochemicals to aid the brain's overall function. With this information, it is essential to note that food insecurity might be another aspect to consider. I know many would agree that hunger makes us irritated. Children with ADHD are no exception. If they are not getting the proper nutrition, let alone getting enough food, it could worsen their symptoms. We believe that assessing the status concerning food security should be done in children with ADHD before changing their treatment program.
Now, look at Extract 2. Extract 2. Questions 37 to 42. You will hear an interview with Professor Nora Alexis about the importance of sleep and its effect on our well-being. You now have 90 seconds to read questions 37 to 42.
We are joined today by Professor Nora Alexis from the Department of Psychiatry at the University of Cambridge. She is the author of many books about the importance of sleep, especially for adults. Let me ask the most commonly asked question about sleep. How many hours of sleep do we really need?
I often get this question from various people, and my answer remains the same. The sleep requirement is different for each age group. For infants up to 12 months, 12 to 16 hours a day of sleep, including naps, is crucial for growth development. Children ages 1 to 5 should have at least 10 to 14 hours of sleep, including naps. Now, when you reach the age of 6, this is when naps are usually gone, because a solid 9 to 12 hours of sleep is already sufficient. As you grow older, your body can effectively function with even less sleep. So an adult just needs at least 7 hours of sleep. In fact, a recent study says 7 hours of sleep is the optimal amount of sleep.
Amazingly, we spend a lot of time sleeping, especially during the formative years. What are some of the adverse effects of altered sleep patterns?
Well, sleep is a significant part of our lives. It enables cognitive function while maintaining stable and good psychological health. In the same way, sleep is also responsible for keeping the brain healthy by removing waste products. You may notice that as we grow older, we often witness changes in our sleeping patterns. This includes difficulty falling asleep and staying asleep, which decreases the quantity and quality of our sleep. With this in mind, it is safe to say that these sleep disturbances may be one of the reasons for the decline of cognitive functions as the presence of psychiatric disorders in the aging population.
So, maintaining the ideal sleep hours is very important. I understand that you are the co-author of an ongoing research about the optimal amount of sleep for adults?
Yes, that is correct. We examined nearly 500,000 adults aged 38 to 73 years old and investigated their sleeping patterns, mental health, and well-being. Some even took part in a series of cognitive tests like imaging and genetic data. We discovered that insufficient and excessive sleep was associated with impaired cognitive performance. Some functions that seem to be affected are managing speed, visual awareness, memory, and problem-solving skills. One possible reason for the connection between insufficient sleep and decreased cognitive processes is the disruption of deep sleep or rapid eye movement, or REM.
Have you seen this connection in patients who have developed conditions with cognitive impairment?
Absolutely. In our intensive research and experiment, we noticed that continuous sleep disturbances increases the production of beta amyloid and tau proteins, a typical characteristic of some forms of dementia and Alzheimer's disease. Cognitive decline is a hallmark symptom of these diseases. Let's talk about a 65-year-old patient at the clinic named Jake Villanueva. He was diagnosed with an early-onset Alzheimer's disease 6 months ago. His sleep history revealed that he had insomnia for almost 20 years, which greatly affected his daily activities. Jake stressed that it was difficult for him to work during the day without napping, and at night he would get so agitated that he would have trouble falling asleep. 1 out of 9 people aged 65 and above who have insomnia is most likely to have Alzheimer's. That is more than 11% of their age bracket.
Are there any other contributing factors we need to watch out for?
Well, aside from counting the optimal number of hours, it is also essential to consider the quality of sleep that we are getting. Good sleep quality has shown positive effects in one's cognitive performance and good mental health and well-being. 7 hours of sleep every night, assuming it is without too much fluctuation and duration, should also be highlighted when talking about the importance of sleep. Various studies have established the association of interrupted sleep patterns with increased inflammation, increasing older people's susceptibility to age-related diseases.
Aside from the effects of sleep on the cognitive aspects, are there other benefits of having a good quality sleep? What can we do to achieve this?
Getting a good night's sleep is necessary no matter your age, but it is more crucial as we age. Remember that sleep is the body's way of getting rid of the brain's toxins, so it's only fitting that we let this natural course happen. Aside from attributing to cognitive performance, sleep is also suitable for mental health. Individuals experiencing symptoms of depression, anxiety, or problematic overall well-being will immensely benefit from a 7-hour, uninterrupted sleep. Maintaining a regular sleeping schedule where you can have a predictable wake and sleep time is one of the simplest, yet most effective ways to get a night of complete and decent sleep. Engaging in physical activities and watching your diet by avoiding stimulants, such as caffeine, is also helpful. However, for those who have underlying difficulties such as anxiety and depression, it is better to seek professional help. Cognitive behavioral therapy paired with relaxation techniques is the go-to treatment. This process is essential to achieving a stable sleeping attitude in the long run.
So is it safe to say that for people who have
That is the end of Part C. You now have 2 minutes to check and transfer your answers.